One of the important and necessary roles that you have as an exercise specialist is to keep our clinic clean. Now, we don't ask you to scrub baseboards or even wash the floors anymore like we did back in our day. But what we do ask is that we can keep the equipment and the tables clean and ready to use. We also ask that you help us stay up on our laundry needs. We use a lot of towels, we use a lot of pillowcases, and it's good that we keep things sanitary. It's so important that we make sure that each patient has individual towels that they use and individual pillowcases that they use. These should not be shared across patients. So we want to make sure we can keep track of these. One of the ways we do that is we actually use a magic marker to write on a patient's pillowcase to make sure that we know whose pillow that is. As we do this, we take that extra little step to make sure that we're not being inefficient with our time and we're not being inefficient with our resources. And it also helps our patients feel like they're seen and cared about. It's quite fun to see a patient say, "Oh, I got my name on the pillow." In addition to this, we also ask that we keep the clinic organized to the best of our ability. We use many stools in our day. We use different pieces of equipment. We also use bolsters that help lift patients' legs for comfort. These are objects that kind of float around the room throughout the day and float throughout our clinic. We want to make sure that these aren't clogging up valuable lanes for people to walk through. That'll help us stay safe, and it'll also help us stay efficient as we make sure that this equipment stays spread out in the areas that it should be. For example, we don't want too many stools on one side of the room. This might seem like a small thing, but when a provider is trying to treat a patient and they have to take 1 to 2 extra minutes to walk around and grab a stool that was halfway across the clinic, this is valuable time that we could be using to work with that patient, keep our flow. So how do we do that? That seems like a lot. Well, one best tip that I have for you is to just clean as you go. If you see a stool in the way as you're walking by, push it in a direction where it's tucked under a table, right where it could be ready to use. Take those little extra times that you can to put things in their proper place. If you ever see me hop in to help out with exercise specialist duties, you'll always see that I have a towel hanging over my shoulder, a pillowcase under my arm, and pieces of equipment hanging over my arms, usually as I'm coaching a patient through an exercise. What I've learned in my years of experience is I don't need my hands to teach a lot of exercises. I'm able to explain them in a way where a patient can do them correctly, and I'm able to take and carry a lot of different pieces of equipment to help clean and organize our clinic. This makes a huge difference. Like I said, it avoids clutter, it keeps everything safe, and allows us to stay efficient. So to the best of your ability, clean as you go. Make sure that when a patient comes off of the table, you're ready to wipe it down and have it ready for the next one. Keep a flow that makes sure that we stay on top of things and stays ahead of the game. To the degree that we do that is a degree to which we'll see everything running smoothly.